Attention to everyone over 70 and anyone who cares for them. Facing surgery isn't just another doctor's appointment. It can be a critical moment that determines how quickly you heal, whether you avoid serious setbacks, and how confidently you reclaim your independence. Here on Elderly Insights, we're committed to arming you with the life-changing knowledge you won't hear elsewhere. Today, I'm revealing 5 essential things you must know before surgery after 70, because missing just one could mean days or even weeks longer in the hospital and complications you never saw coming. Hit subscribe and ring that bell right now, because what you learn next could transform your recovery. Let's get started. 1. Understand how anesthesia affects you differently. As we age, our bodies process anesthetic drugs more slowly. That can mean longer grogginess, confusion, or even delirium after you wake up. Questions to ask your anesthesiologist. Will I receive general anesthesia, regional block, or local? How long until the anesthesia wears off? Are there lighter or alternative options for someone my age? Schedule a brief pre-op consultation at least 1 week before surgery and share any past reactions you've had to anesthesia, even from decades ago. 2. Optimize your nutrition before surgery. Seniors naturally lose muscle mass, which slows healing and increases the risk of falls. Aim for 1.2 g of protein per kilogram of body weight every day by focusing on lean meats, dairy, beans, eggs, or supplements. Add vitamin C-rich foods, citrus fruits, bell peppers, and zinc sources, nuts, whole grains, to boost your immune response. Hydrate consistently. Drink an extra glass of water with each meal, unless your doctor advises otherwise. Keep a simple food and water journal so you and your care team can spot any gaps. 3. Review every pill and supplement you take over the counter. Meds like ibuprofen, herbal supplements such as ginkgo or turmeric, and even fish oil can increase bleeding risk or interfere with anesthesia. Create a complete list of all prescriptions, over-the-counters, vitamins, and remedies. Then ask your surgeon or nurse practitioner, should I stop, continue, or adjust any of these before surgery? Pay attention to timing. Some meds must stop 7 days prior, while others continue up to the morning of surgery. Use a pill organizer and alarms on your phone to avoid missed or extra doses. 4. Plan your recovery environment and support hospital stays, and the first days at home can be disorienting and exhausting. Arrange for a trusted friend or family member to stay with you for at least 48 hours post-discharge. Clear walkways, remove loose rugs, and stock easy prep meals ahead of time. Set up a recovery station in your main living area with a comfortable chair, water pitcher, phone charger, reading glasses, and a simple grabber tool. Contact your local area agency on aging or senior center to learn about home health aid services or volunteer visitor programs. 5. Cultivate a positive mindset and manage stress. Your mind is more powerful than you may realize, especially when it comes to healing. Research shows that patients who engage in positive imagery, relaxation techniques, and purposeful stress management not only feel less pain but actually recover more quickly and are discharged sooner. Here's how to turn your mental state into a recovery superpower. A. Daily guided breathing and mindfulness. Why it works. Controlled breathing slows your heart rate, lowers blood pressure, and signals your nervous system that it's safe to relax, counteracting the fight or flight surge of stress hormones that can delay healing. How to start. Dedicate just 5 minutes each morning to a simple breathing exercise. Inhale slowly for a count of 4, hold for 2, and exhale for 6. If you prefer guided practice, use a free mindfulness app or a short YouTube video tailored for seniors. Stick to a consistent time, right after waking up or before breakfast, so it becomes as routine as brushing your teeth. B. Positive visualization. Why it works. Your brain often can't distinguish between vividly imagined experiences and real ones. By mentally rehearsing success, Walking pain-free, returning to your garden, playing with grandchildren, you train your neural pathways to expect those outcomes. This can reduce perceived pain, increase motivation, and even boost immune function. How to practice. Close your eyes for 2 minutes each day and see yourself thriving after surgery. Walking steadily down the hallway, preparing a favorite meal, or enjoying a laugh with friends. Engage all your senses. Feel the ground under your feet, smell the air in your garden, hear the laughter around you. Repeat this exercise anytime you feel anxiety creeping in, before appointments, during pre-op prep, or in the hospital waiting room. C. Gratitude journaling. Why it works. Focusing on positive aspects of your life reduces rumination on fears and worries. Studies link gratitude practice to improved sleep, lower levels of inflammation, and better overall mood, all factors that contribute to a smoother recovery. How to keep a journal. Each evening, write down 3 specific things you're grateful for. It could be as simple as a warm cup of tea, a kind phone call from a friend, or a sunny morning. Be detailed. Rather than, "I'm thankful for family," write, "I'm thankful for Maria calling me today to brighten my afternoon." Review your entries on tougher days to remind yourself of the positives you're building toward. D. Emotional sharing and support. Why it works. Bottling up fears and frustrations can amplify stress, which in turn can slow healing and increase pain perception. Talking things through helps you process emotions, find solutions, and feel less alone. Ways to share. Schedule a weekly chat with a trusted friend or family member. Let them know it's okay to check in specifically about how you're feeling about the surgery. If you prefer privacy, consider a short series of sessions with a counselor or therapist experienced in working with older adults. Join an online or local support group where others facing surgery can swap tips, encouragement, and real-world advice. Incorporate small uplifts throughout the day. Why it works. Scattering mini pick-me-ups resets your stress baseline, preventing negative thoughts from spiraling. Ideas to try. Place a favorite photo or inspiring quote where you'll see it first thing, your bathroom mirror, the fridge door, or bedside table. Listen to an uplifting song or devotional for 2 minutes while having your morning coffee. Take a brief sun break. Step outside, weather permitting, for a minute or 2 of fresh air and natural light, which helps regulate your circadian rhythm and mood. By weaving these practices into your preoperative routine, you're not just preparing your body, you're empowering your mind. When stress is managed, positivity is cultivated, and emotional support is in place, you set the stage for a recovery. That's not only faster, but also more confident and even uplifting. Preparation truly is power, especially when facing surgery after 70. You have the ability to transform what could be a daunting experience into a controlled, confident journey toward better health. By taking charge of how your body handles anesthesia, fueling yourself with the right nutrients, keeping a careful eye on every medication and supplement, lining up a reliable support system, and fostering a positive, can-do mindset, you're not merely hoping for the best, you're actively engineering the smoothest recovery possible. Think of anesthesia as more than just a sleep potion. It's a critical factor in how you'll feel the moment you wake up. By discussing options, whether it's general, spinal, or local, with your anesthesiologist days before, you ensure you're given what's safest and most appropriate for your age and health profile. Nutrition isn't an afterthought. It's your body's pre-surgery training plan. Building muscle stores with lean protein, fortifying your immunity with vitamin and mineral-rich foods, and staying properly hydrated primes every cell and tissue to bounce back faster. Remember, it's not just about what goes on your plate. It's about how that fuel powers your healed self. When it comes to medications and supplements, transparency is your secret weapon. A complete list shared with your surgical team prevents dangerous interactions, minimizes bleeding risks, and keeps anesthesia running on schedule. Small adjustments, like pausing a turmeric supplement or timing your blood thinners, can be the difference between a smooth operation and a setback. Support isn't a luxury, it's a necessity. Arranging for someone to stay with you after you leave the hospital guarantees safety and companionship when you're most vulnerable. Simple home adjustments, clearing walkways, prepping easy meals, setting up a recovery station, turn your living space into a healing haven, reducing falls and frustration. Finally, your mindset is the hidden engine driving every stage of recovery. Daily mindfulness practice, positive visualization, and gratitude journaling build emotional resilience, lower stress hormones, and even help control pain perception. Cultivating calm confidence before your procedure sets the stage for a post-operative attitude that sees challenges as surmountable rather than insurmountable. If these insights resonated with you, please like this video. Your thumbs up helps more seniors discover vital guidance. Share in the comments which of these 5 steps you'll implement first, or ask any lingering questions so we can address them in upcoming episodes. Don't forget to subscribe and activate the notification bell. Every week we bring you evidence-based strategies, practical checklists, and heartfelt stories designed to protect your independence and enrich your golden years. Here's to your strength, your resilience, and a future of healing that unfolds on your terms. Stay informed, stay prepared, and remember, you're not alone on this journey. See you next week on Elderly Insights.